At the International Dermal Institute, we use manual extraction techniques. We don't use comedone extractors. They can mark the skin, they can damage the skin, and the use of extractors and even lancets is often not legal in certain areas. So as we turn the face, I'm going to position the lamp. I've already done my skin analysis. I know where extractions are going to be. I'm going to come in to the side, keep my fingers slightly apart, and I'm going to come in and just slightly wiggle, wiggle, wiggle. And we're just rolling the skin gently and then wiping off any debris, okay? So come in, position, wiggle, 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 and just wipe off any debris. Now if, as you're working on the skin, it's a comedone and it's not coming out easily, change the position of your fingers. Come in, wiggle and wiggle, and then just wipe. You can come around, try from different angles. Make sure you're working on a non-infected lesion. Just see it wiggling up right there. If it's an infected lesion, we're not going to attempt to extract it. What we're going to do in that circumstance is we're going to use direct high frequency. And there you can see the impaction just sliding out. Don't force from one angle. Come around. Now remember, you can move around the bed. You can come to the side of the bed if it's easier for you to work. And we're extracting in the direction of the hair growth. Remember how the hair comes down? And we just wiggle, 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 slightly apart and remove. When it comes up to the nose area, let's look at the nose because that's a slightly different situation. When we do extractions around the nose, we're going to support the side of the nose with our thumb. We're going to come slightly to the side of the couch and we're going to press up on either side. So let me just show you. We're going to hold the nose so that you're going to push the nose onto the face. We're going to just put one finger underneath the nostril. Client can breathe. Don't breathe through the nose because we're only working on one side of the nose. Come in with our finger on the other side and we're just going to wiggle, wiggle. And you see how that nasal groove just pops up. I'm going to wiggle, wiggle, and just come all the way down. As I press, you see the nasal groove just pop up and impactions just slide out. So that's the sides of the nose. Now, as you're working on the nose, sides of the nose just pop up like that. There may be very minimal extractions, there may be a lot, but also look carefully. The top of the nose, we're actually going to come in and go either side. It's almost like taking each follicle separately. Same movement, just roll, roll, roll over the top of the nose and then work over to the other side of the nose. And again, come slightly to the side of the bed. Move the lamp in. Support the nose with the one thumb. Come in with the other underneath. Bend the nose slightly over. With your other finger, come in and just wiggle, wiggle, wiggle. And just squeeze, and you'll see the impactions just pop up in the nasal groove. When you've finished with your extractions, we cover the whole skin, allowing your treatment time about 8 minutes in order to do extractions. We then would wipe over the skin with our sponges and clean water, and we would then also follow with a post-extraction solution, which would be a sanitizing solution designed for the purpose. So we would come in with our sponges, we would wipe over, because remember we left our disincrustation solution on. So we would wipe over the skin, and then we would come in with cotton, always 2 pieces, so we work in unison together. Our post-extraction solution, which is a sanitizing antibacterial solution, just dampen it down, and then we would come in with both of our cotton pads, wipe over the skin. If you're using high frequency, direct high frequency can be used after extractions, and we would make sure that the area is completely sanitized, has an antibacterial covering, and then we would be ready to go into the touch therapy or the massage portion of